Welcome everyone to the Canadian Diabetes Association's 2016 webinar series. My name is Farah Ismail and I'm a program manager for CDA, and I will be your host this evening. We are delighted that you're able to join us today for a webinar to learn about taking a step forward, preventing and managing foot problems. Now, to start us off, I would like to draw your attention to our survey. It's located at the top right-hand section of your screen. In order for us to serve your needs better, we kindly ask that you provide us with your input by completing the short survey towards the end of the presentation, and we thank you in advance for your input. Throughout the presentation, you will have the opportunity to type in the Q&A box, and that's located at the bottom right-hand section of your screen. And we ask that you use this box for any questions you may have for the speaker along the way, and we'll be happy to answer them at the end of the presentation. As well, we will be displaying a few polling questions throughout the presentation and would love for your participation. It is important to note that our polling questions remain completely anonymous. Also note that you are able to customize your screen, so you can do this by expanding and collapsing them by dragging down the bottom right-hand corner of each of the webinar pods. So please feel free to adjust them as you see fit. Our presentation today will last about 40 to 45 minutes, and we'll have about 10 to 15 minutes left for questions and answers. And it is important to note that we will be posting our webinar on our diabetes.ca website as well as our CDA YouTube channel. So now I'd like to welcome our speaker, Teresa Salzmann, and thank her for joining us today. But before turning it over to Teresa, I'd like to give you a brief introduction. Teresa is a staff chiropodist at Anishinaabe Health Toronto, providing foot care for the Aboriginal community. She is a chiropodist member and team lead for the Diabetes Education Program. She provides education on foot health to prevent complications for people living with diabetes. As well, Teresa has a certification in wound care from York University. For more information on Teresa, please read the speaker bio section, and that's located at the left-hand section of your screen. So, without further ado, I'd like to present to you Teresa.
Thank you very much, Farah, and welcome everyone to Taking a Step Forward, Preventing and Managing Foot Problems. To get an idea of who our audience participants are, I would like to start with the first polling question. So, if you can answer this question for me, how are you affected with diabetes? And your choices are on the screen. So if you can take a minute and do that, we'll check the results. Okay, so looking at the results, we have some people with type 1 diabetes, some with type 2. We have a few at risk, some caregivers and family members, and about a third healthcare professionals, which is great to see. So to start off my presentation, I would like to ask the audience a very specific question. So, if you're living with diabetes, you can prevent complications by having your hemoglobin A1C on target, having your blood pressure controlled, having your cholesterol low, diet, healthy eating, exercise, physical activity, or all of the above. So let's take a moment and answer that question. And so the correct answer would be all of the above. Basically, keeping your feet healthy and preventing complications involves the A, the B's, the C, D, E, and F's of managing your diabetes. Let's start with A. A is for your hemoglobin A1C. Optimal blood sugar control levels are the first line of defense against diabetes complications. By maintaining control of your blood sugar levels, you can minimize the damaging effects of unpredictable blood glucose levels on the body. Poorly controlled blood sugar levels can cause nerve damage, and this can interfere with your ability to sense pain and or temperature. This is called diabetic neuropathy. B is for blood pressure. Blood pressure is the reading or the measurement of the pressure against the walls of your blood vessels. Aiming to keep your blood pressure within target is extremely important in decreasing the risk of heart disease, stroke, kidney disease, and eye disease. Keep your blood pressure under control, and this will help decrease the risk of developing any foot problems. Then we get to C, and C is for cholesterol. And when we're discussing cholesterol, we're talking about the bad cholesterol, is the LDL cholesterol. Keeping your cholesterol levels low prevents clotting or clogging of artery walls. A blockage of the artery wall can lead to poor circulation, as it can restrict the blood flow. By keeping your cholesterol, your LDL levels low, you may prevent symptoms such as pain and or cramping of the feet or the legs, any difference in discoloration in your feet, and slow healing. C is for diet and nutrition. The key is eating healthy, which includes whole grains, vegetables, fruits, lean meats. There's a recommendation to cut out simple sugars and salty foods. It is important to attain and maintain healthy eating. Outcomes of a healthy diet include blood glucose levels in normal or close to normal to prevent or reduce complications of diabetes. It is important also to note that proper nutrition is very important in wound healing. And this is very true for individuals that develop sores as well as individuals who have ulcers on their feet. E is for exercise. Regular exercise or regular physical activity is very important for maintaining your diabetes. This includes walking, running, swimming, and stretching. Benefits of physical activity achieve a variety of goals. It increases vigor, improves glycemic control. This activity does lower the blood sugar levels. It can decrease insulin resistance. It improves your lipid profile. It lowers blood pressure, and it helps maintain weight loss. It is important to note before starting a physical activity program that you check with your healthcare team or your diabetic team. A word of advice, it is very important to make sure that you have the proper footwear for the physical activity that you will be doing. For example, if you are going to be walking, you want to ensure that you have a comfortable walking shoe. And remember, socks to go with that. If you're going to be running, make sure that you have a supportive running shoe. And of course, wear socks. If you're going to go swimming, you should have some pool shoes. And this will help not only with moving around the area of the pool, but also contracting infections such as warts or fungal infections. And we get to F, and F is for foot care. It's all about preventing complications. Foot problems can be prevented by managing your diabetes and taking good care of your feet. You can prevent problems before they start. So the next set of slides that I will be presenting and discussing will deal with diabetes and foot problems. I will be presenting tips on how to prevent these problems. So, prevention tip number 1. Living with diabetes requires you to pay special attention to your health and your condition. It is important to follow your doctor's instructions regarding diet, exercise, and medication. Keeping your blood sugar, your glucose levels within recommended range is one of the best things you can do to control your condition and protect your feet. The recommended range for your blood sugar levels should be discussed with your diabetes team. This brings us to another polling question. So, the question is, I'm living with diabetes, and I should check my feet daily, I should check my feet weekly, monthly, or yearly. Please answer the question, and we'll see what the results are. Fabulous. 98% answered daily. That's exactly right. Living with diabetes, one has to check their feet on a daily basis. Prevention tip number 2. Carefully inspect your feet daily. To do that, you've got to make sure that you look at the top of your feet, in between your toes, and the bottom of your feet. If you are unable to see the bottom of your feet, it is recommended that you purchase a break-proof or shatterproof mirror so that you can position the mirror and be able to see the bottom of your feet. If you have a family member, you can also get a family member or partner to check the bottom of your feet for you. When you're checking your feet, please make sure that you check for any blisters, corns, calluses, or cracks. For that matter, any abnormal skin lesion that you find. Check for any redness or swelling. And with this, you may also notice the temperature of the foot. Is it colder? Is it warmer? Check for ingrowns, and this is for ingrown toenails. Is the ingrown toenail sore? Is there any discharge coming from the skin? And check for any other changes in your feet, and this would include swollen joints and or changes in the size or shape of your feet. Prevention tip number 3. These are foot care tips on how to properly care for your feet. The first thing is wash your feet daily with a mild soap and water. Be sure to check the temperature of the water that you are using. If you don't have good sensation in your feet, you can use the thermometer or your elbow, and the water should be lukewarm. Avoid soaking your feet. Do not soak your feet at all if you have a sore on your foot, as this can cause problems. If there are no sores on your feet, soaking or excessive soaking can contribute to dryness of your skin. It is important that after you wash your feet, you dry your feet completely and paying a special attention to areas in between the toes. Prevention tip number 4. After bathing, use a pumice stone or emery board to smooth hardened areas of skin on the feet, which may be corns or calluses. It is important to note that corns and calluses should be assessed and treated or brought to the attention of your healthcare provider, chiropodist, or foot care specialist. A pumice stone will smooth the hardened skin, but the underlying cause of the corn and callus should be addressed and treated. Please ensure that you don't purchase any over-the-counter corn pad or medicated corn pads, as these can cause open sores and lead to numerous complications. Moisturize your feet daily, but when doing so, make sure that you don't apply the moisturizer in between the toes. And the reason for that is excessive moisture in between the toes can cause cracking and peeling of the skin, which again can lead to unwanted complications. This is another question that I would like the audience to answer. And this question reads, you have been diagnosed with diabetes, and with this diagnosis, you no longer should be cutting your own toenails. Is that true? Yes. Or false? No. Take a couple of minutes and answer that question for me, please. Okay. So the majority of the audience chose no, that it is false. And that is, in fact, correct, with one exception. So if you're able to see your feet, if you're able to reach your feet, if you have good sensation in your feet, and you've got good manual dexterity, you can cut your own toenails. This is a big component of self-management. However, as I mentioned, there is one exception. An exception is if your toenails are thick, hard, and or curved or infected, you should have your nails assessed and treated by your healthcare provider. That takes us into prevention tip number 5. So, once a week, examine your toenails. And this is to assess whether they need to be trimmed or cut. If you are able to see, reach, and you can feel your feet, you can cut your toenails straight across using a nail clipper. But also make sure that you smooth the rough nail edges with an emery board after clipping. Do not cut down deep into the sides, as this can lead to ingrown toenails. And that's one thing we want to ensure we prevent. So if we look on this slide, it gives us an example on how to position and how to cut your toenails. So first of all, ensure that there is good lighting when you're cutting or trimming your toenails, and make sure the area and the clipper is clean. The suggestion I have for people cutting their own toenails is to follow the white line. And this is to guide you on how short to cut your toenails. Once you've cut the toenails, if there are any edges, as the second slide or diagram will show you, use an emery board to file any rough edges. If you leave the nail cut straight across, it can lead to sharp edges. These sharp edges not only can cause holes in your socks, they can also do is puncture the skin or create breaks in the skin of the adjacent toes. And this, again, can lead to complications. Prevention tip number 6. So proper footwear, socks, and stockings can go a long way to help protect your feet. Choose well-fitting socks and stockings that contain soft elastic throughout. Wear proper fitting shoes. And by this I mean shoes that feel comfortably on your feet, not the shoes that you have to, and I put these in quotation, break in. By breaking in a pair of shoes, you can cause blisters and sores that can lead to ulcerations and infections. It is important to avoid walking barefoot, even at home. Protect your feet by always choosing slippers or closed-toe shoes. As we all know, there can be many hazards around the home, from sharp objects that may be on the floor to furniture that you can stub your foot against. These hazards can contribute to serious injury and therefore can be avoided by having a pair of slippers or closed-toed shoes. So a couple of tips on protecting your feet would include: always wear socks when wearing shoes. Not wearing socks when wearing shoes can cause shearing stress, which can lead to the formation of blisters. As we know, blisters can break, and this can cause a portal of entry for bacteria that is everywhere, and this can lead to infection. Avoid wearing jewelry on your feet, and this includes toe rings and ankle bracelets. Although this can be fashionable, this can also be very dangerous. Toe rings and ankle bracelets can cut off circulation. If there's any swelling, it can irritate, and it can cause abrasions. And my last point is, check to make sure that there is nothing in your footwear before putting them on. If you have children or pets at home, objects can end up in your shoes. Please ensure to make a habit of checking your shoes when you're ready to put them on. As the warmer weather is approaching and you will be exposing your feet to the sun, please make sure that you use sunscreen to avoid any sunburns to the feet. We're going to look now at the diabetic sock. I want to bring to your attention 3 important features of a diabetic sock. The first feature is the color. The color of a diabetic sock should be white. And the reason for that is, if you cannot feel what's going on with your feet, you can look at the white sock and notice any staining, be it blood or any other discoloration or discharge on the sock. The diabetic sock should have soft, elastic, or compression throughout. If there is uneven compression, where there is that uneven compression, it can constrict or impinge circulation, and that tends to be around the top part of the calf area. If the sock is too loose, the tendency is for it to slide down your leg and bunch up in the shoe, and this as well can cause problems. And the third feature of a diabetic sock is there should be no seam around the toe area. This helps in preventing any rubbing from the seam, which can lead to skin injury. Now, we spoke about footwear, and footwear is very important. Shoes that you wear should fit properly. When fitting a shoe, one must ensure that there is enough width and depth, therefore enough room to wiggle your toes. So if you look at the slide, we have the positioning of all the toes, and from this slide you can see that the toes don't appear constricted, and there should be enough room to wiggle the toes. Ensure that there are laces, because as the day goes on, many of us will experience some swelling in the feet. So with the laces, you can adjust them to ensure that the shoe fits comfortably throughout the day. Good shock absorption and sturdy heel counter. And as mentioned previously, do not buy a pair of shoes that you have to break in. With that, I want to discuss with you the features of a good, sensible shoe. And again, this includes a good, firm heel counter. Soft and padded, but firm. There should be enough width in the shoe so that there is no rubbing of any joints. There should be enough depth in the shoe, again, to ensure that you can move and wiggle your toes freely. Laces or Velcro are a good feature. As I mentioned previously, if there is any swelling throughout the day, can be adjusted to accommodate the foot. Good shock absorption. As you do walking, you want to ensure that your foot is comfortable and well padded. So good shock absorption is very important. And if you look at the slide with this particular walking shoe, you've got a good amount of shock absorption. A proper fit also includes no rough seams. So when examining a shoe, make sure that you put your hand inside the shoe and feel for any rough seams or edges. And this is true if you don't have great feeling in your feet or if you have a foot deformity such as a bunion, because you want to make sure that that seam doesn't lie in the area where the bunion is. Otherwise, that can lead to rubbing and complications. Prevention tip number 7. These are a couple of tips that will keep the blood flowing to your feet. So, if you can, prop your feet up when sitting down. Try and wiggle your toes frequently. That helps with the blood circulation. Take frequent breaks to flex and point your toes in and out, and to circle your feet in one direction and in the opposite direction. So clockwise a couple of times and then counterclockwise. Please ensure that you avoid crossing your legs, and this is especially true for when you're sitting for long periods of time, as this can impinge the flow of circulation to your feet. Prevention tip number 8, avoid smoking, and if you do smoke, quit. We all know that smoking aggravates the blood flow problems, and this affects the circulation of your feet. The reality is smoking can undo all the benefits gained by good blood glucose control, weight loss, healthy eating, and controlled blood pressure. Prevention tip number 9 is the infamous annual foot exam, and this is an important component of diabetes management. The annual foot exam consists of 5 examinations. One of the examinations is examining your circulation. We check to see if your pedal pulses are present. We check the capillary refill time, and we also check the color and temperature of the feet. We do a neurological test, and this is where we examine on how good or how adequately you can feel your feet. The examination usually consists of a monofilament, which you see on the slide, and we test different parts of the foot to see if you can feel it. We also examine the skin of the feet. We look for open sores, dry skin, flaky skin, corns, calluses, warts, and any other abnormal lesions. We examine the toenails. We look for ingrowns, curved nails, very hard and thick nails. And then we also examine any changes in the foot shape or the foot structure. And this would include bunions, flat feet, and clawing of the lesser toes. So we come to a question that everyone asks. when do I seek help? And the answer is when you notice any changes to your feet. First of all, let's talk about changes you can't see, but you can feel. We're talking about abnormal sensation in your feet. Abnormal sensation can include numbness, could include tingling. It may be a sharp shooting pain that you feel. You may feel pins and needles. You may feel burning or throbbing. Any one or combination of these feelings, it is very important that you contact and inform your healthcare provider about the abnormal sensation. It is very important to assess the cause of this abnormal sensation to ensure there is an appropriate treatment. Now, if you notice any changes in the skin color or the skin temperature, looking at the slide, we can see there is some redness in the big toe joint, and the skin is shiny. If we were to feel that foot, more than likely there would also be an associated temperature change. Usually an area of redness is of concern. With that, an increase in temperature. And we're concerned about areas of redness because it means there's inflammation or possibly infection going on in the area. We should also be concerned if the skin appears bluish or there are black spots. Usually with this type of foot, it feels colder compared to the rest of the leg or the other foot. It is important to note that any changes of the skin or temperature of your feet should be immediately reported to your healthcare provider, as it is quite concerning. Now, if you notice foot or ankle swelling, foot or ankle swelling is a sign that there is something going on internally that has to be checked. This should be addressed by your family doctor or nurse practitioner or your healthcare provider. The swelling in the feet and ankles can lead to a variety of problems. Now, in this slide, although the woman is not wearing appropriate footwear, but you can see with the swelling of the feet, it can lead to problems with fitting of shoes. It can lead to blisters. And it can lead to breaks in the skin that can lead to ulcerations and infections. Now, if you notice corns, calluses, or cracked skin, the appearance of dry skin, corns, or calluses, or cracks on the feet require that you see your medical provider. Hard skin anywhere on your foot can cause pressure, which can in turn cause an underlying blister. If this blister breaks, that can allow bacteria into the area, which can lead to infection. If we look at the slide, we see callus on the heels. Callus on the heels can cause cracks in the skin. And again, any opening in the skin can allow bacteria in and lead to infection. Remember, daily checks are very important. Dry skin can also be a concern for people living with diabetes. A common cause of dry, scaly skin is a fungal infection. It's important to note that if you have dry, scaly skin that does not clear with regular applications of moisturizing cream, that you contact your healthcare provider to assess and treat the foot problem. Warts. Warts are common on the hands, and they are just as common on the feet. Plantar warts can be picked up around public pools and showers. They can also be picked up when you're trying on shoes without wearing socks. Warts on your feet usually cause a buildup of hard skin called callus due to the fact that you're walking on them. They can be painful, But if you have neuropathy, or you don't have good sensation, they may not be painful. Now, they differ from calluses in one particular way. First of all, they're infectious, and you can distinguish a wart from a callus because they've got tiny little black spots. The hard skin buildup, again, as with corns and calluses, can cause blistering. And as mentioned in previous slides, the blisters can break, and this can lead to bacterial infection, entering the sore, and creating complications. Our next slide is an ingrown toenail. Ingrown toenails or toenails infected with fungus should be reported to your healthcare provider as well. Ingrown toenails are nails that are curved into the skin and that cause an opening. If the ingrown toenails become infected, the surrounding tissue becomes red, and there at times may be a discharge. If we look at this slide, we can see the big toe, the side of the big toe. There's some redness there. And usually that is one of the signs that there may be a skin infection, bacterial infection lingering in the area. If we look at the toenail itself, there is some yellow discoloration and what appears to be a little bit of thickness. And this is what a fungal nail may look like. Fungal nails are a bit discolored, they're thicker than normal, and they are crumbling. The thickness of the fungal toenail can, again, cause pressure, which can in turn cause blistering underneath the toenail. And again, as previously mentioned with other lesions, these blisters can break, portal of entry for bacteria, and infection can set in. If you notice oozing, open sores that appear to drain, or wounds that are slow to heal, these are all very important signs as to contact your healthcare provider. Two important points to note. If your feet have an open sore or blister, the first thing you should do is wash the sore with warm water, pat it dry, and put a bandage over top. The next thing is call and make an appointment to see your healthcare provider if you have any concerns about the sore. Concerns about the sore would include any change in color, if there is any discharge or liquid coming from the sore, or if the sore is slow to heal. So that takes us to our healthcare team. So basically, in summary, preventing and managing foot problems involves you and your healthcare team. Each member of the team plays a vital role. Your team should include your family doctor, your diabetes nurse educator, your registered dietitian, and of course your chiropodist or your foot care specialist. I'd like to bring to your attention two recommendations that are listed in the Canadian Diabetes Association Guidelines 2013. So in people with diabetes, foot examinations by healthcare providers should be an integral component of diabetes management to identify persons at risk for ulcerations and lower extremity amputations, and should be performed at least annually and at more frequent intervals in those at risk. Recommendation 1 continued states, assessment by healthcare providers should include the assessment of skin changes, structural abnormalities, which includes range of motion of the ankle, toe joints, callus patterns, and bone deformities. Should include skin temperature. Also, should include evaluation for neuropathy, peripheral vascular disease, ulcerations, and evidence of infection. Recommendation number 2, people at high risk of foot ulcerations and amputation should receive foot care education, including counseling to avoid foot trauma, professionally fitted footwear, and early referral to a healthcare professional trained in foot care management if foot complications occur. And with that, I conclude my presentation, and I'm open to any questions at this time.
Thank you so much, Teresa. This has been a really, really great learning experience for myself as well as all the other participants on the line. You've shared some really, really great knowledge in terms of preventing and managing foot problems for people living with diabetes. So we really, really appreciate the knowledge you've given us today. With that being said, we do have quite a few questions from our audience here. So let's get that started so we can get as many in as possible. And folks, just to let you know, if we do not get to your questions today, we do apologize, but please email us at webinars@diabetes.ca and we'll be sure to get back to you. So with that, I'll start with our first question. One of our participants has asked, I have a slight numbness on the underside of one big toe. Should I be worried, and is there anything I can do about this?
Okay, so slight numbness under the big toe. This should be assessed by your healthcare provider, be it your family doctor, your chiropodist, or your foot care specialist. Numbness in the big toe can be caused by a multitude of factors. It could be caused by the positioning of your big toe, something we call a hallux limitus or a bunion, and that can impinge the nerve, and that can contribute to numbness. Numbness can also be caused if there is some callus buildup in that area. So that can also contribute. You may not feel the area as well. So definitely, even slight numbness should be brought to the attention of your healthcare provider to have it properly assessed and to discuss the appropriate treatment plan.
Great. Thank you so much for that response, Teresa. I'll move on to our next question here. One of our participants has asked, why is soaking your feet not recommended?
Okay. So let's talk about soaking your feet if you have an open sore, and then soaking your feet if you don't have any open sores. So soaking your feet if you have an open sore, not a great idea. The reason for that is you're putting your foot into a basin of water, which the pail may be clean. Is it sterilized? No. So you may be contributing to an infection. And second of all, soaking the foot really makes the area waterlogged. And if your skin is waterlogged, again, it does contribute to poor healing. So having an open sore and soaking is definitely not a good idea. Now, if you don't have a sore on your foot, is it a good idea to soak? There is controversy with this. Some people suggest you can soak up to 10 minutes. Therapeutically, it may be therapeutic. However, again, always erring on the side of caution. Excessively or soaking your feet, in effect, can also cause or contribute to the dryness of your feet. So keeping that in mind, soaking your feet, even though you don't have any sores, will tend to dry up the skin. So in my opinion, not a good idea to soak your feet.
Okay, great. Thank you so much for that response, Teresa, and for clarifying that really well. Our next participant has asked, are the new AMOPay or electronic foot callus removals, are they good for people with diabetes?
The electronic callus and corn removers. Not a great idea. And the reason for this, twofold. First of all, we want to determine why the callus is building up in the first place. Is it pressure, or is it some other condition? Conditions such as psoriasis can cause buildup of skin or callus. A wart can also have overlying callus. So by using this device on an area like that, you may be doing more harm than good. If you have psoriasis, that includes a totally different treatment regime. If it's a wart and you're using that instrument on other areas of your foot, the risk of spreading the infection increases. Now, if we look at someone living with diabetes that doesn't have good sensation, again, using this instrument on that particular foot can be very problematic because you don't know how much of that skin you're actually removing because you're not feeling the discomfort. If you remove too much, that can cause, again, the skin to be very tender. If it's very thin, more likely to break, to crack. And again, portal of entry, bacteria, and that's where our complications set in. So
great,
definitely not a great idea.
Thank you for that response, Teresa. We'll move on to our next question here. One of our participants has asked, is it advisable to go to a salon to have a pedicure, and if you're living with diabetes? And if not, what type of professional would you recommend to have cut your toenails?
Love this question. So going to a spa is not advisable. Going to a spa to have your nails done or a pedicure is of concern because you're not sure what background knowledge the provider has about diabetes, which is your condition. The other concern we have with salons is the cleanliness of the instrument. Again, if an instrument isn't cleaned properly, isn't sterilized, then what's happening is we're cross-contaminating others, so you're more likely to develop various infections. And just something that comes to mind is people going for a pedicure and having some nails put on, let's say for your manicure. What people are finding is it does damage your nail. And again, by using instruments that are not sterilized, the tendency of develop fungal infections is quite high, and that is seen both in fingernails and in toenails. In regards to recommending a professional, my background is a chiropodist, and in Ontario, you should seek a foot care provider that is either a chiropodist or a podiatrist. However, having said that, we have a lot of nurses that have taken advanced training in foot care. And again, those would be also good healthcare providers to help you with your toenail care.
Great. Thank you so much for that response, Teresa. Our next participant here has asked, if you have a bunion, should you get it removed?
Okay, so if you're living with diabetes and you have a bunion, surgical removal is not always recommended. So there are reasons for that. We would recommend a surgical consult with an orthopedic surgeon if you have a bunion for two reasons. Number one, if the bunion is very large. So there's a large deformity, the bunion is protruding, you're having difficulty fitting shoes. If you do fit a pair of shoes, you have irritation. There's break in the skin because of the rubbing. That is a referral for orthopedic surgery, and that is a consideration that the orthopedic surgeon makes because it is affecting your quality of life. The other one is if you have a bunion, which is small but painful. So you're still able to fit shoes, but you have pain. It is painful to walk. Again, this affects your quality of life, It will limit the amount of physical activity that you do. So again, a referral to the orthopedic surgeon for surgical intervention is warranted at that time.
Great. Thank you so much for that response, Teresa. We're just winding down to the end of the hour here, folks, so we'll take a few more questions before we close off. And again, please email us at webinars@diabetes.ca if we do not get to your question today. Our next participant has asked, can you give a guideline as to what you mean by slow to heal?
So usually a sore can take up to 7 to 10 days to heal. So I'm giving you quite a fair amount of time. But again, as the wound is healing, you see the progression of the healing. If the wound is slow to heal, it's usually taking a longer period of time. So within, a 7 to 10 day period, we haven't noticed any healing. So it's not getting any smaller. It may be getting red. It may be having a discharge. So those are all factors that contribute to slow healing. But again, slow healing, rule of thumb, usually within a week's time, if we don't have a lesion that's healed, it is of concern. And it should be addressed by a healthcare provider.
Great. Thank you for that response, Teresa. Our next participant has asked, do we need a referral to a podiatrist from our GP?
No. In Ontario, you don't need a referral to a podiatrist or a chiropodist. That is true in private practice. It may not be the case, and this is why it's a really good idea to either ask your family doctor or do some investigating on your own. If the person or the provider is not in private practice, but in a community health center or in the hospital, in that case, you may require a referral. Or in the case of community health center, there may be certain guidelines that you need to comply with. One example being, you should be living within the catchment area of the health center, or you're a member of the diabetic team at that health center. So in that case, you wouldn't need a referral. But again, it's always important to check with the provider if they require a referral or not. But as I said in the beginning, usually in private practice, no referral from a family physician is required.
Great. Thank you so much for your response, Teresa. Our next participant has asked, do you have any additional suggestions or recommendations when buying dress shoes? I work in an environment where walking shoes are not really acceptable.
That's an excellent question. And we can get a sensible dress shoe, believe it or not. So something that you want to wear or you're expected to wear to work in regards to a dress shoe, again, should follow the majority of the features of a good, sensible shoe. So, again, ensuring that there's enough room to get your foot in there and try and wiggle the toes is important. The quality of the material. Usually a good leather will stretch. Again, not the best recommendation, but if this is what is required for work, that is a good alternative, is a good supple leather so there is stretching. A bit of a heel is fine, not those great tall stiletto heels, but a little bit of a heel is fine. It actually acts to stabilize the foot. So if you notice a person walking in a heel, they walk actually quite straight. And if we compare that to a person walking in a very flat shoe or a flat boot, like an UGG, especially during the winter, people that have problems with their feet tend to roll in. You can really notice that with the footwear. Again, getting back to the dress shoe, again, the points that I mentioned, and one additional point is try and get something that has, again, a little bit of shock absorption, especially around the forefoot area. Because, again, with a dress shoe, a little bit of a heel can cause more pressure on the ball of your foot. So a little bit of shock absorption there is ideal. And again,
great, thank you.
Just one additional comment. Just ensure that when you're wearing a dress shoe, it's for sure. Don't do long walks in dress shoes. That's one recommendation. Always go back to that sensible walking shoe.
Great. Thank you for that response, Teresa. We'll just take our last question here. Our next participant has said, I'm a 24-year-old male currently dealing with nerve damage and have had type 1 diabetes for 10 years now. What can I do to heal nerve damage?
This is a question that should be asked to your family physician and then a referral to a neurologist. That's a question that's basically beyond my scope at this time. The more appropriate person to ask would be the neurologist. As again, there are many other contributing factors to the nerve damage that can be addressed by the specialist. The specialist can provide you with recommendations or even treatments that can help with the nerve damage.
Great. Thank you so much for that response. And that concludes our webinar for today, everyone. I'd sincerely like to thank Teresa for speaking on behalf of the Canadian Diabetes Association. As I mentioned earlier, it's been a really great learning experience. Again, folks, I just want to remind you for the questions we didn't get to, please email us at webinars@diabetes.ca, and we'll be sure to provide you with a quick response. Another reminder is our webinars will be made available online. So our previous ones from this year, our webinars from last year, as well as this one from today, will be made available in the next coming weeks on diabetes.ca. We have one more webinar coming up for this series, so that'll be next week, March 24th, on diabetes and sexual health. So please join us next week for that. And for those of you living with diabetes and are close to our Winnipeg region, please be sure to check out our Winnipeg Expo on April the 23rd. So for more information on that, you can call us at 1-800-BANTING. That's 1-800-226-8464. Or you can visit our website at diabetes.ca/expo. For any other questions or information or resources if you're looking for with regards to diabetes, please do not hesitate to contact us here at CDA. Again, that number is 1-800-226-8464. Thank you for joining us today, and we hope you've had a lovely time, and we look forward to your participation next week.